I might need to convert it to PDF.
Yeah. Journal. Journal.
Recording in progress.
Welcome, Chioma. Welcome, Ogechi. You join. You will join.
Ugonna,
Yes.
send me your email. Let me send the slide to you. Let me mail it to you so that you try sharing it from your side.
Okay.
Yeah.
So I've sent you my email address. Yeah. Let me see if I can open.
Okay. I think you can share now from your end.
Okay. Okay. So I'm sharing now. Confirm you can see my screen.
I can see your screen.
Okay. Okay, great. Thank you. Thank you. All right. So I think you can go ahead.
Can you make it full screen? Click on the projections and
It's on full screen. Is it better now?
Yes, it's fine now.
Okay. Okay.
All right, good morning, everyone.
Good morning.
My name is Uche Obu. I'm a consultant obstetrician and gynecologist, and I'm based in Abuja. So this morning, I'm going to be talking about understanding menstrual cycle, menopause, and beyond. I'll also be talking about the female hormone. Next slide. So by way of the outline we're going to use, we're going to introduce female reproductive hormones. We're going to define certain terms such as menstruation, menstrual cycle, menarche. We're going to talk about common symptoms during menstruation. We're going to talk about problems associated with menstruation, and we're going to talk about menopause and problems associated with menopause. Next slide, please. Okay, so this diagram, I'm going to use it to explain the female reproductive hormone. So from the top, you will see a diagrammatic representation of the human brain. So everything about a female hormone starts from the brain. So there are two parts of the brain that is central to a female reproductive system. That is the hypothalamus and the anterior pituitary gland. So certain hormones, I'll try as much as possible to break it down in a way a layman will understand, but you know that there are certain terminologies that there's no other way you can say it. For example, if I want to talk about the name of a hormone, there's no other way I will say it. Okay, so the first hormone is secreted in the hypothalamus, and they are generally called the gonadotropin-releasing hormones. So that gonadotropin-releasing hormones, if you follow the arrow, would then act on the anterior pituitary gland. Then anterior pituitary gland release two very important hormones, the follicle-stimulating hormone and the luteinizing hormone. Then the luteinizing hormones then moves to the ovaries. So when they act on the ovaries, they help in egg development and all the hormone production at the ovaries. And the two commonest hormones produced in the ovaries is the estrogen and progesterone. Any woman of reproductive age group also produces testosterone in little quantity. Then the estrogen is the hormone responsible for the feminine features you see in a woman. Then progesterone is a hormone that plays a key role in maintaining the lining of the inner part of the womb, and it also helps maintain pregnancy if you get pregnant. There's another important hormone I also want to highlight. It's not shown on this diagram. The hormone is called prolactin. Prolactin is produced also at the anterior pituitary in the brain, and it commonly acts on when it's produced at the brain, it's moved through the bloodstream to the breast. In the breast, the main aim is milk production, and it's supposed to be at certain level until when a woman is pregnant or breastfeeding. But commonly in practice, what you observe is there are certain women, for either as a result of nipple stimulation by their partner or as a result of abnormal enlargement of arterial pituitary gland, and in rare occasions, stress, it will lead to excessive production of this hormone called prolactin. And the commonest presentation is nipple discharge when you are not pregnant. So in such women, because the prolactin is elevated and is giving the female system a kind of making it feel as if she's pregnant, she's lactating, it will go back and inhibit the production of follicle stimulating hormone and luteinizing hormone, and that will also result in anovulation. Anovulation means absence of ovulation, and it could also result in irregular menstrual cycle and so on and so forth. So this is like just an overview. So the female hormone production starts from the brain before it moves to the genital organs, specifically the ovaries. Then the ovaries will then produce the two key hormones, the estrogen and progesterone. I'll talk more on it as the discussion continues, or if you have any question. So let's dive into the main topic. We'll go on the next slide. Okay, so let's define menstruation. It's commonly referred to as, you can call menstruation, you can say menses, you can say menstrual period, you can say menstrual flow. They are all the same thing. And it's defined as the cyclical shedding of the inner lining of the womb. remember the keyword, it must be cyclical. Means that it should have a pattern. Either it's coming monthly, every 28 days, every 25 days. Sometimes there could be few days variation, but usually cyclical. So if it doesn't have any pattern, it's also a sign that there is a problem. And commonly, it lasts between 2 to 7 days with average of 4 days. So if your menses last for more than 7 days, that means it's abnormal, it's prolonged. Then if it lasts for less than 2 days, that means it's also abnormal. Then the average volume is 80 mils per day. And this should fill about 4 average size perineal sanitary pad. Anything more than that might raise a suspicion of heavy menstrual flow. When it's less than that, you suspect that the menses is scanty. So looking at this diagram, you will see, I tried to, what is labeled, is a diagram showing the uterus, the ovaries, and the fallopian tube. What we call uterus is actually the womb in layman's term, and it has the muscle part and the innermost part, which is lined by a specialized form of cells that grows from time to time and shed for you to see your menstrual period. So in medical term, we'll call that lining the endometrium. So is this endometrium that grow gradually, starting from end of your flow? So when, for example, you have an average flow of 4 days. So when you start shedding, let's say at the 4th day, from the fifth day, it starts growing gradually, When it's getting to, let's say you have a 28-day cycle to day 27 and there is no pregnancy, from day 28, it starts shedding. And the growth is usually maintained by a combination of estrogen and progesterone. So if there's any balance in any, or an imbalance in any of them, then that will result in either the lining overgrowing or the lining being abnormally thin, and you might not have your menses at the end of 28 days. Next slide, please. So let's talk about menstrual cycle. Menstrual cycle is the interval from first day of menstrual flow to the first day of your next menstrual period. Commonly, most women struggle with calculating their menstrual cycle. They start calculating from a day after their period. That is wrong. The first day of your menstrual cycle is the day you start seeing blood, and you calculate to the next period. So the interval from that first day to the next period is what is called menstrual cycle. And like I earlier mentioned, it's supposed to be regular. The average menstrual cycle varies from 21 days to 35 days. If a menstrual cycle is less than 21, it means it's abnormal. If a menstrual cycle is more than 35 days, it means it's also abnormal. And the average menstrual cycle period is 28 days. So if you have a menstrual cycle of 24, 23, 25, 26, even 32, and it's cyclical, it's normal. If there is change in the days, and that change is not more than 7 days, is normal. For example, you used to have 28 days, and in some months you experience 30 days. That is also normal. Ugon, I can't see the slide. Well, let's continue. Can I continue? I can continue without the slide if you want.
Yes, continue. I'll share it soon.
Okay, so little variation between 2 days to between 1 day and 7 days is usually considered normal, but you should also try to see a doctor if you start seeing a variation that is more than 7 days in your menstrual cycle. And the menstrual cycle can be regular or irregular. It's regular when it has a pattern and is cyclical. It's irregular when it doesn't have a pattern. For example, you used to see your menses every 28 days, then you then start seeing it every 36 days. Sometimes it will go back to 21 days. Sometimes you will skip it or it stay 2 months. At that point, you say that the menstrual cycle is irregular and is also a thing of concern. There is a term called menarche. Menarche is the age of first menstrual period, and it's important that every woman or reproductive age group should remember the age she started menstruating. The reason being that certain condition start manifesting start giving you a sign right from when you start menstruating. For example, if the average age of menarche is 10 to 16 years, if by 17 years, if let's say, for example, you started seeing your first period at 18 years, it's already a sign that there might be a problem or there is a delay in development of your female genital tract. And when you are interacting with your doctor or your gynecologist, it's important to let him or her know when you started seeing your first menses. So if it's before 10 years, it's very early. If it's after 16 years, it's late. Then if by 14 years, you've not started, the person have not started seeing the menses, her menses, and there is no sign of female secondary sexual development, such as there is no breast, no axillary hair or hair on pubic region, is also a concern, and it's advisable for you to see a gynecologist so that they will investigate the cause of the delay. Next slide. So let's talk about the common symptoms observed during menses. The commonest symptoms observed is the lower abdominal cramp, and usually it varies from one person to another. The lower abdominal cramp is because of the contraction when the womb is trying to contract to expel the blood that is accumulating inside it. It's usually more painful in ladies that have not delivered before. And the reason is because in most women or nulliparous women who have not had any form of vaginal delivery or even cesarean delivery, the opening to the womb is like a pinhole. It's very small, very tiny. So the muscles of the womb need to contract to a certain level to be able to force that blood to go out through that pinhole. And it varies, the severity varies from one woman to another. There are people that suffer conditions like adenomyosis, endometriosis. I'm going to talk about it later as this presentation progresses. For those ones, the pain is exaggerated, but it's not as a result of just the contraction of the muscles of the womb to release the shedding of the inner lining and blood accumulating inside. Other common symptoms include you could experience mood swings, mood changes, bloating, you experience poor sleep, food craving, and even low appetite, headache, breast tenderness and breast fullness, and acne, commonly called pimples. So these symptoms vary from one person to another. So you don't expect that one person will have everything. There are some cycles you might even have some of these symptoms. Some cycle you might not really have it. So like, for example, there are women that don't really experience lower abdominal cramp or pain when they are menstruating, while in others, the pain could be severe that they might need painkillers to control the pain. Next slide. Okay, so let's talk about the common problem associated with menstruation. The first one is premenstrual syndrome. Premenstrual syndrome is a set of symptoms a woman develops few weeks, like from between few days to 1 week before the actual onset of the menses. And these symptoms usually disappear as soon as the menses start, or from the first day of the menses. And they include mood swing, they include severe breast tenderness, lower abdominal pain, and in some, the mood swing could be severe to the level of appearing like it's depression. But one thing is key: before you target premenstrual syndrome, once the person starts seeing a period, these symptoms usually disappear. If it lasts longer than first day of period, then you will not regard that as premenstrual syndrome. It might be from other cause and needs to be investigated. Other common problems associated with menses would be absence of menses. There's a number of reasons why a woman will miss her period. First on the list, it could be pregnancy, it could be hormonal imbalance, it could be things like polycystic ovarian syndrome, it could also be drugs, and so on and so forth. Then painful menses, we'll call it dysmenorrhea. And commonly they have two types, the primary and secondary. The primary painful menses usually starts from the first time a woman of reproductive age group starts menstruating. Why the secondary happens that of a sudden you start feeling pain during your menses, or as gynecologists, because during your menses, for example, you might start noticing severe menstrual cramp during menses. It could also be a sign that, or maybe you've started developing conditions such as adenomyosis.
I think his network is unstable, right? Okay, so let's just give him a few minutes. He should be back. Let me contact him. Thank you. Okay, he's back. Welcome back, doctor.
Yes, I think it's my network.
Yes, welcome.
So I want to know where I stopped. Let me, at the point the network logged me out.
Irregular menses. We were speaking about common problems associated with menstruation, and you were on irregular.
I think I was on the, I was still on the painful menses. I was talking about the primary and secondary. Is that correct?
Yes. That's dysmenorrhea.
Okay, so
yes.
Yes, the secondary dysmenorrhea or secondary painful menses is usually as a result of disease condition and should be investigated. Then other common problems include heavy menstrual flow. Heavy menstrual flow is when you start noticing menstrual loss in excess of 80 mils per day. So it could be in terms of quantity, it could also be in terms of the number of days. That's theoretically, but practically, some of the ways you can quantify it, for example, you used to use 3 pads to contain, 3 sanitary pads to contain your menses, all of a sudden increase to 6, 7, 8 is often of concern. Normally you don't see blood clots in your menses, and all of a sudden you start seeing blood clots in your menses. It's also a point to heavy menstrual flow. Or your period usually lasts for 4 days, you now prolong for 7 to 8 days, or even longer than that. That is also heavy menstrual flow. Then irregular menses, I talked about this earlier. If the menses is not cyclical, Then endometriosis. Endometriosis is a condition where the inner lining of the womb is also found in other part of the genital tract, and in severe cases, even on the intestine. So what it means, sometimes you see it on the ovaries, sometimes you see it on the body of the uterus, sometimes you see it on the intestine. So at the point where the hormones is making the inner lining of the womb to grow, those cells there are also growing. So when it's time for you for your menses to, once your menses starts, as the inner lining of the womb is shedding blood, those places are also shedding blood. But because they are in abnormal location, they start irritating the structures around there and start causing inflammation, leading to severe pain to the person. So most times, if a woman is having an extraordinary painful menses, the person should be investigated for endometriosis, because it could be as a result of the other surrounding structures to the womb also shedding blood, thereby eliciting a kind of inflammatory changes around that area. So if you experience very severe menstrual period, you shouldn't always be taking painkillers. You should talk to your doctor or talk to your gynecologist, because you might have endometriosis. And it has different classification. It could be mild, moderate, and severe. A moderate and severe condition, it starts making the organs around in that region to start coming together, and it commonly leads to tubal blockage. It commonly leads to infertility. And if it's detected early, there are ways it can be managed before you advance to severe. Because most times in severe condition, probably you can only conceive through IVF, because at that point you would have blocked the tubes, would have made the ovaries to have thick walls and also affect ovulation. The next one is adenomyosis. Adenomyosis is when the cells lining the womb start growing into the muscles of the womb. So when the inner lining is secreting or shedding, releasing blood, those cells in the muscles also do that, and they commonly present with heavy menstrual flow and also severe menstrual pain. Commonly, sometimes adenomyosis can be misdiagnosed as uterine fibroid, because both of them usually make the fibroid the womb to enlarge. Next slide. So we've talked about menstrual cycle. So what happens when menses comes to an end? And that will lead us to menopause. But before I go into menopause, usually the period between 5 to 10 years before menopause, a woman will start experiencing certain changes. For example, your period used to be regular, all of a sudden it starts, you're now 40-something, it starts being irregular. It could be a sign that menopause, you're about to get to menopause. And we usually call that period climacteric period or premenopausal period, premenopausal period, and it lasts between 5 to even 15 years before your menopause, sorry. So the term menopause starts from meno, as in it was derived from menses, then pause. You know, when they say pause is to stop something. So it's just basically stopping of menses. But it's defined as permanent cessation of menstrual period. And for you to say this is permanent means that the person must have stayed for 1 year without seeing her period. That's when you will now make that diagnosis of menopause. And at that point, the reproductive career of the woman has come to an end. And it happens between the age of 45 and 55 years. If it happens between 40 and 40, call that early menopause or premature menopause. If it occurs before less than 40 years, you call that premature ovarian failure. Because why is we regard that as premature ovarian failure is that a woman of reproductive age group is not supposed to abruptly stop seeing her menses before the age of 40. And if it occurs after 45 years, that is late menopause, and it has its own disadvantage because it increases the risk of the woman developing cancer of the inner lining of the womb. Next slide. The common symptoms and problems associated with menopause include low mood, hot flushes. Hot flushes is defined as a sudden heat wave associated with sweat. You might be in a very cold inside and the classical principles. You're also going to experience reduced libido because these hormones such as estrogen, progesterone, and so on and so forth that supports the function of female organs and also sex drive and so on and so forth, the production will drop when you get to menopause. As a result, the woman will start experiencing reduced libido, they experience vaginal dryness. And because they have vaginal dryness and vaginal atrophy, they will experience Can you hear me?
We can hear you now, but it's breaking. The network's not very stable. Can you hear us? Network is unstable. Okay, I think he stepped out. Okay, he's back again.
So I was talking about palpitation before my network. Sorry, I'm having some network glitches this morning. Palpitation is ideally you're not supposed to be as have the feeling of your heart beating, except maybe when you exercising or maybe are doing a tedious work. But if at rest you start being conscious of every single heartbeat, then we usually call that palpitation, and you could experience that during menopause. You also experience headache, muscle aches, joint pain, poor sleep. So it varies from one woman to another. You could have like probably about 4 of these symptoms. Some will have all the symptoms. Next slide. So how do we manage menopause? There is no, despite the advances in medicine, there is no cure or there's no way we can say we can completely reverse menopause. But science have advanced in a way that there are certain things we can do. For example, there have been recorded pregnancy in the woman that have gotten to menopause by trying to replace certain hormones, try to do certain treatments to try to rejuvenate the ovary to release egg. In some occasion, they will use an egg donor through in vitro fertilization, that's IVF, for them to get pregnant. Boys. A moment, please. Hello.
We can hear you.
Okay, all right. So how do we manage menopause? So the management depends on the symptom of concern. And I'll just mention some of them. So for those having mood swing, especially when it's severe, you could do cognitive behavioral therapy. It could be like a group talking therapy where they join other women experiencing similar symptoms and someone that understand menopause will try to explain to them for them to understand that it's as a result of the changes that are ongoing in their body that is making them have those mood swings, and talk to them about ways that can help improve their mood, such as trying to do things that they used to enjoy, the pleasurable activities they used to enjoy, also trying to exercise. So some of these things studies have shown to be beneficial to postmenopausal women that are having low mood. Hot flushes is advisable for the person to avoid tight clothing, have cold baths, especially during episodes of hot flushes. Avoid hot environments because it's usually worse when you're in a hot environment. Then the vaginal dryness is advisable. They could use water-based sex lubricants. There are also estrogen creams available that have been found to be beneficial for them. And also for the painful sex, the same thing, use of water-based sex lubricant has been found to be helpful. And for those experiencing muscle aches and joint pain, regular exercise, including trying weight-bearing activities, use of calcium supplements and other supplements have been found to be helpful. Next slide. So adequate rest and sleep is advisable in them. Calcium-rich food like milk, yogurt. There's a lot of supplements that they've mentioned that are helpful, but I didn't want to list them because most of them, there is no randomized control trial supporting them. And some have shown to be beneficial to those that use them, while some women that have used them have complained that they didn't see any change. So I try to be silent on most of these supplements. Then lastly, you can have hormone replacement therapy. Hormone replacement therapy is actually a big topic, and I think is beyond the scope of this discussion. But to just summarize, it's a form of treatment where you try to replace certain hormones with the aim of helping the woman either achieve pregnancy or to helping the woman reduce the symptoms she's having. But there are drawbacks. One of the commonest drawbacks of this hormone replacement therapy is at that point is going to increase the risk of having conditions like ovarian cancer and endometrial cancer. So before you opt for that form of treatment, you should discuss with your gynecologist about risk, and it's not recommended for people with family history of cancer such as ovarian cancer and cancer of the womb. Above all, talk to your gynecologist. Thank you very much. I'll be taking your questions at the end of the webinar. Thank you.
Wow, thank you very much, Dr. Uche. That was very impactful. We're able to learn a couple of things, number of average pads someone should use in a day before you're able to get worried about, is it too small or is it too much? You talked to us about dysmenorrhea, you talked to us about average days for menstrual cycle, and then of course menopause, management of certain symptoms in menopause. So much to learn. Thank you very, very much. And thank you everyone for joining. So we're going to go back to the next part of the presentation, which is how Kenix Pharmacy supports support your hormone.
Are we going to take the other presentation before the questions?
Yeah, so that we can take everything at the same time. So we can take all the questions at the same time.
Okay, that's fine. Thank you.
Thank you very much. Okay. All right, I'm going to invite pharmacist Tochukwu of Kenix Pharmacy. Yes, so he will take us on Kenix Pharmacy, supporting her hormones and her health. Thank you for paying attention so far. We hope you've learned a lot. Yes, so Tochukwu will take over now. Let me just put this. Okay.
Good morning, everyone. Good morning, everyone. I'm Pharmacy Tochku by name, and I'm here to assist you on how Kenix Pharmacy can help you boost your hormonal and regulate them as well, and make your life easy and well going. So today we are going to focus majorly on different and many aspects of how Kenix Pharmacy will be able to manage your hormonal health, manage the challenges you face, and even when you come, we will help you to address some certain issues as well. So as our doctor has said, as he has defined hormones for us, as he has enlightened us about hormones, I would like to add that hormones impact our mood because they are majorly produced in the brain. So that makes it affect our psychology, makes us address it the way we think, the way we reason things. And also it helps our energy of the day, whether in the day we'll be having a lot of energy, which is also directly linked to our mood as well. Then it also affects our sleep pattern. So maybe we're having too less sleep, too much sleep. It's also a hormonal related something. And generally our overall health as ladies, as women, it affects it as well. So we see that many women face hormonal challenges that affect daily life. But we at Kenix Pharmacy, a very experienced pharmacist and well-knowledgeable pharmacist offers tailored support for every stage of life, both the young ladies that are just entering the menstrual cycle period, the ones that are already there, and the ones that are about to leave. That's our elderly women as well. The Kenix Pharmacy, we help with one-on-one conversations to ease your complaints, so that you can tell us the problems you are having. So, and our pharmacist here, including myself, who can tell you how you can address the issue. So there will be a one-on-one conversation with the pharmacist in Kenix and the patients as well. So there will be a tailored procedure to like address your issue for your personal interest. You will not just say, okay, because you presented us with this issue, this is what you're going to take. No, just personalize everything for yourself alone. So in Kenix Pharmacy here, we have access to hormone balancing supplement and treatment. So, on this page, you have the vitamins. We have vitamins like zinc, we have vitamins like vitamin D, magnesium, calcium. These are nutraceuticals as well, like the evening primus oil, the chasteberry. This one helps to like regulate your hormones so that the hormone will not be too excess or will be too low, which is not really good for each of these stage of life of these women, of these ladies. And also, as the doctor has said before, they have prescription option like hormone replacement therapy and contraceptives. They also have the natural balancers like omega-3 and probiotics. And these medications are sourced from very, very good importers, manufacturers as well. And they are stored in very, very good, adequate conditions so that the molecules in these medications will not degrade, will not reduce, that their potency, the efficaciousness of these medications will not reduce. And look at our medications, we have the ones like Cyclogel. This belongs to the hormonal replacement therapy. We have Sinego, we have Primoluz, and we have the Fastone. All these are like primary medications to treat a particular condition. Conditions like endometriosis, as the doctor has explained, adenomyosis, as the doctor has explained, for painful, excessive menorrhagia, and the likes. We also have Levofem that belongs to the same class. We have Postino2 as well that contains levonorgestrel, and I believe that most of us know this levonorgestrel already. Then here we have Well Woman Plus containing omega-3 system, which is a part of an example of the natural balancers like the probiotics. So this Well Woman Plus helps to manage women hormone. Like most of those women that are already menstruating as well, this is what they particularly need. Then we have the nature's field calcium, magnesium, and zinc. So for those are menopausal women, post-menopausal women rather, that are having this body pain, muscle pain, joint pain, and the likes, this ideal supplement is very, very good for them. Then looking at Diravite for our women that are like most of their secondary features might not be well developed, this Diravite can help to boost things like that. So like for people having low libido, for people having low sexual drive, for people that are having some other condition associated with low hormones, this Diravite is very, very good for them. So we also have evening primrose FMO brand. It's a very, very good medication for women that are presenting symptoms like acne or pimple that are related with hormonal imbalancing, hormonal complications and problems. This FMO is very, very good. They also have omega 369. It's a very good combination as well. So like the FMO, we have the MP Woman. It's another very good brand to address hormonal imbalancing. Then we have NADB. NADB has a lot of nutraceuticals in it, has a lot of vitamins in it to act on your body, to act on your brain, to act on your gonads, on your organs that are responsible for this hormonal aspect, hormonal health in general. So we also have another brand here, Nutrify Women, for just women particularly, women of normal childbearing age and all of that. So here at Kenix Pharmacy, we also make recommendations, personalized recommendations for women and their particular symptoms. So for the few women that we have in mood swing, we urge them to eat mood boosting food like omega-3, complex carb. You can also ask them for those who are having severe mood swings, severe mania or depression associated with this hormonal issue, they can see a therapist. That's when it's very, very severe, a psychologist or a psychotherapist, yes. Then another one, they stay active and practice mindfulness. As doctor has already said, Dr. Uche said, you can do things that will make you happy, things that you are used to doing that will make you joyful and boost your mood. Then another one is taking B complex vitamins and magnesium. This ones listed here, they help to like calm the mood down. So for those people that because of their menstrual cycle, they will be aggressive, they can be maybe very intense. This one will help and calm them down, stabilize it. So for those people having excessive cramp, as doctor said, that should be menorrhagia. He said we should use heat therapy so that the pain will reduce and try natural remedies like ginger. Another option is to stay hydrated and exercise regularly. That can also reduce the cramp. Then for the cramp that are very excess, very, very intense, that you can't bear with just a few personal routine changes, they have to take painkillers, and painkillers are various types that can address any of these issues. Then another symptom that are faced that can address is the people that have hot flashes. We ask them to wear breathable materials, wear light clothing. So people putting on jeans, people putting on hoodie, sweater, things like that. We'll ask them to do away with those ones for now and just wear more of light materials, colorful materials rather than the dark ones. Then for the supplement, they can use black cohosh and soy isoflavonoid. Then like Well Woman that is contained in the Well Woman as I listed before, as I said and emphasized on before. They should also avoid triggers like caffeine, alcohol, spicy food. So for our women, our ladies, our mothers that like spicy food, a lot of pepper, a lot of spice inside, it's not really adequate for them. It's not do them good for them experiencing this hot flash. So why Kenix Pharmacy? Why should come Kenix Pharmacy when you're having hormonal irregularities? There are a lot of reasons. One of the first reasons is experience and caring pharmacists are ready to listen to you. Not just myself, there are also other of us that are going, when you come, might meet anybody on the morning shift or on the night shift. But anybody that you meet is well certified to encourage you and in your own best interest on how to handle these issues. Another is affordable options of medical hormone health. So the medications that I listed are very, very affordable. There are a lot of affordable, very, very good brands, very efficacious brands. These brands are safe and trusted products tailored towards your need. Then another one is community support through our Kenix Care Conversations like this. So that sometimes even when we don't do the physical, when you don't come, you can have an online one-on-one discussion about the particular hormonal challenges they are facing for our women. then empowering you through information and support. So sometimes you can ask questions maybe on WhatsApp or on some other social media handles, so that we will always reply you, whether it's being your symptoms, whether it's a medication you want to get to manage your symptoms. We're always here and ready to help you. Then how to reach out to us. We have 3 branches now. We have the first one, the second one, the third one. Is the first branch, which I am at, is number 78 Community Road, Ago Palace Way, Okota, Lagos. They also have our Kenix, which is our new brand. Then finally, our newest premise is at Aso Road, Bucknor Street. Yes. And if you cannot, or if you are not able to come to these places, you can reach us on our social media handles like TikTok, Instagram, and the link and the description is on the slide there, so you can copy and always check up on us and get across to us. We'll always be there to assist you and give you feedbacks to whatever your complaint or your request would be. Thank you. So now we want to receive your questions. So we can text them in the description box, or you can raise your hand so we can unmute you and listen to your questions and answer them accurately for you. Then if it's something that will be needing you to further come to the pharmacy and discuss with us, or meet a consultant when we see fit that, okay, this is beyond our scope, that you should go and meet a consultant, a gynecologist like Dr. Uche, then that will be also fine. Thank you.
Okay, so thank you very much, everyone. Thank you, Tochukwu, for that fantastic presentation on how Kenix Pharmacy supports our women to live a very beautiful life. You've looked at some of the products that we have available at Kenix Pharmacy, which are of the highest quality possible and accompanied by exceptional pharmaceutical service by our team of pharmacists. At Kenix Pharmacy, we have over 5 pharmacists always on duty. So for every time you come to Kenix Pharmacy, you're going to meet a pharmacist that you can discuss with. And then, of course, the products, like he said, are sourced professionally from the right sources and stored in the right temperature to avoid degradation, like he has already said. Okay, cool. Thank you very much. Does anybody have a question? Go ahead and raise your hand or unmute and speak. Our doctor is still online, so this is a very good opportunity for you to ask any questions that you have around female hormones. We don't usually get this opportunity to have a consultant gynecologist available to answer our questions. You know, now if you have to go to a hospital, you have to book a card, consultation fee,
you have to
waiting time. It's a lot. But now you have the doctor right here to answer our questions. So please feel free to come off mute and ask your questions, and they will be attended to. Or if you also want to leave it on the chat box, that's also fine. We can read out your questions on your behalf. Maybe the presentation was so wonderful that everybody understood everything. And there is no need to ask a question. Is that what's going on? Okay, well. Okay. Yes, I think someone is raising his hand. He's on mute. Okay, there's a question. Okay. You can unmute and ask. Okay, thanks. Please go ahead and unmute.
Please unmute from your end to be able to hear you.
Okay, we have a question on the chat. While we wait for the person to unmute, we have a question on the chat box. Okay, so Lucilla is asking, it said, first of all, thank you, Dr. Uche and Kenix Pharmacy. You're welcome. My question is that my cycle is not regular and I'm finding it difficult to calculate my ovulation day. My cycle is 23 days, 25 days, 26 days, and 27 days. But is it possible for someone to get pregnant during her fertile days or only on ovulation day? So Dr. Uche, please go ahead.
Okay, let me attempt the question. Hold on, let me read. Okay, so my cycle is not regular and I'm having difficulty calculating my ovulation day. Okay, so usually the first day of the menses is 14 days from the day you ovulate. So if you have a 25-day cycle, you minus 14 days from that 25 days, that's going to give you 11. So you're likely going to ovulate on the 11th. So that's average, going to be your average ovulation day. And when we say fertile period is actually few days before that day and few days after that day, because since egg and sperm can survive inside a woman between 72 hours, between 48 hours and 72 hours. So 3 days before that day, before that 11th, is among your fertile period. That 11th and, excuse me, 3 days after that is also your fertile period. So this fertile period is the period you are most likely going to conceive. And the closer to the ovulation day, the better. So you have to, if your menses is varying between 23 days, 25 days, 26 days, 27 days, you have to check which one is most consistent, because the day to actually see fall within normal cycle length, you have to check which one is more consistent. Let's say, for example, in a year, you had more of 25-day cycle than 26 and 27. So on the average, you are going to have 25 days. So your ovulation period is likely going to be day 11, counting from the first day of your menses. So what you are going to do is that 2 to 3 days before this day 11, you start having frequent sex with your partner. That's day 11, and 2 to 3 days after that day. If there's a slight change, let's say, for example, you ovulated, sorry, something is irritating me. You ovulated on day 10.
Sorry.
You won't be able, you won't miss it. If, for example, there's a change and you ovulate on day 12 or day 30, because you are still having sex for 2 to 3 days after that day, you won't still miss it. So that is, you actually target to be very sexually active during that fertile period, and you don't give a gap of more than 24 hours. For example, if you have sex on Monday and you are not able to have sex on Tuesday, you shouldn't miss Wednesday. That by that way, you are unlikely going to miss the ovulation period. But in all this, there's an interplay between the ovary, the fallopian tube, the womb, and even the cervix before pregnancy will be achieved. All this is assumed that the tubes are patent. So despite this calculation, if the tubes are blocked, the egg and sperm will not be able to meet and there won't be any pregnancy. So sometimes when you try several and it's not working, you should see a gynecologist so that you'll be properly evaluated and the cause of infertility will be detected. Is it possible for someone to get pregnant during fertile period? Why not? Yes. It's not only during your ovulation period, because sperm can survive for up to 48 hours inside your genital tract.
Okay.
Is there any other question?
Yeah, there's the second part of that question. It says, if someone had fibroid and ovarian cyst, like how many months can someone wait to conceive?
Is it that you had surgery for removal of the fibroid or ovarian cyst?
Olutola, can you clarify?
So if it's, for example, now you have it, you've not had the surgery. Of course, it depends. If you just have few small size fibroid that their location is unlikely to affect fertility, you can just go ahead and try to conceive him. But if it's big fibroid, some are found inside the womb, all those ones could affect your fertility. Or then if she's asking her with regards to removal, usually we advise you to wait for about 6 months after removal before trying to conceive. But if the woman is already advanced in age, because of time, sometime after 3 months to tell you to start trying.
Thank you, doctor.
Then please, what age range for late and early
Puberty.
early puberty?
Yes.
Okay, so usually the age range we use for puberty usually corresponds to that for menarche, and is usually between just the puberty just 1 year before menarche. So from 9 years of age to age 16. But like I said, if at 14, the person does not have any sign of secondary sexual development, you start investigating the person. You don't wait till that 16 to start investigating. And if someone achieves start going into puberty before the 9 years of age is early. Is it possible that menopause can set before 40 years? I mentioned it, and before 40 years, you can achieve menopause. At that point, we don't call it menopause, we call it premature ovarian failure. Then between 40 to 45 years, you call it early menopause or premature menopause. When does menopause start? On the average, it's between 45 years and 55 years of age. So if you start but you should also know that female fertility starts declining from 35 years. But for those that have PCOS, theirs can even start declining from 30. But decline doesn't mean that you won't be able to conceive. It means that a lady that is 18, early 20s is likely going, when you are that age, you're likely more going to conceive faster than when you are more than 35. So that doesn't translate that you're getting to menopause. There will just be decline, or maybe there will be more difficulty in conceiving.
Okay, the next question.
Thank you for this. I couldn't start early. Okay, but when does menopause start? Oh, I think she has answered.
There is another question I need to answer. Sorry, a moment. Let me take my intercom. Hello.
Okay.
Yeah. No.
This is a good time for you to invite your friends to.
Okay, my question.
Yeah.
Okay, the another person asked. My question is from a client who I attended to and complained of severe pain on her hip to left femur bone during each menstrual menses. What could be the reason? This has lingered for about 2 to 4 years. Now she has started experiencing this from fourth and fifth child. Okay, so they need to investigate for the cause. One of the cause could be from endometriosis. If there's endometriosis and there's a deposit on her sciatic nerve, there could be a radiation of pain on the place she's describing. Then another thing too is she also needs to be investigated to be sure that there was no challenge during the course of her delivery that could have affected her sciatic nerve. So I think this patient should actually be referred to a specialist. The last question, I stopped breastfeeding since October, but I still have nipple discharge. What could be the cause? Okay, so there's a lot of reasons that could still be, even the cry of your child can stimulate the production of prolactin. So what you should do is still observe it for after 6 months. But if you are worried, you could see a doctor. There are medication that can be safe, medication that can be used to stop the nipple discharge. Thank you very much. Is there another question? So in absence of any other question, I need to run along. I have patients to attend to.
Thank you, doctor.
Thank you very much, Dr. Uche. It has been an enlightening section, and we're really grateful.
All right. I want to be sure that there's no other question before I go.
I think someone is raising his or her hand, but is not able to unmute. We've asked the person to unmute, but
no, she's one of the Phoenix is one of the questions I answered. I think she.
Okay, she typed in the question. Oh, okay.
Yeah, the last question I answered on chat.
Okay. Okay, hi everyone. Please, if you have any other question, you can unmute and ask your question directly before our doctor signs up, because he has to attend to patients. As you can see, this is almost like a free consultation session. So please ask your questions.
All right.
Yes. Go ahead and ask questions now. That's the essence of this meeting, to bring you closer to your consultant, your specialist, your pharmacy, to discuss your health and improve the quality of your health. Okay.
I've got a question, doctor.
Okay, go ahead, please.
My question is, okay, a woman that is going through menopause, what is the multivitamin you advise for them to be taking? Thank you.
Please, can you restate your question so we hear audibly?
Right. I say for people that are going through menopause, what is the multivitamin you advise for them to be taking, like for the bones and for their well-being? Did you get my question?
Yes, ma'am, we got it, ma'am, loud and clear.
All right, thank you.
Doctor.
Dr. Uche. Dr. Uche.
I think it's part of this presentation. Just on hot flushes.
Okay, while we wait for, what's the question?
Multivitamins.
Multivitamins. Okay. All right. Thank you, Sandra. While we wait for Dr. Uche to come back, during his presentation, he shared that calcium-rich foods are actually good, and then yes, like milk. And then in terms of multivitamins, you can find that in multivitamins like this one that contains calcium, magnesium, zinc. There is also MP Woman that contains evening primrose. There is also menopause. Yes, there's also menopause that contains these essential vitamins that help. The Nutrify Woman also contains very good multivitamins and probiotics that help in menopausal symptoms and even premenopausal symptoms as well. So these are some of the multivitamins that will generally help in that situation.
Does that answer your question, ma'am?
Yeah, thank you.
You're welcome. You're welcome. Any other question? Any other question?
Chat box. I think there's something on the chat box. Yes, there's a question on the chat box, but the doctor is not here. Go down, go down. Okay, what medication can I take to stop nipple discharge? And then there's another question. Let me see if I can reach Dr. Uche. For nipple discharge, usually excess prolactin. Yes, so you might take medications that will address that, like bromocriptine, and yes, I think we have that on the slide. So you see bromocriptine and carbagolin, those ones to reduce prolactin levels and reduce nipple discharge. I hope that answers your question. This is in Phoenix. Okay.
Someone is talking now. Please, can you speak up louder? Hello?
Okay, then the next question is, please, how possible is it for someone with multiple fibroids to get pregnant? Okay, I think we'll have to forward.
There's a possibility that the person can get pregnant, but it will be with very close monitoring from a specialist like Dr. Uche and like
Other gynecology.
on other gynecology, but a close monitoring will be very, very crucial and necessary. I believe so. Any other question?
Hello, sorry, I heard the last question when I joined briefly, but I'll be stepping out shortly. She asked, is it possible for someone with multiple uterine fibroids to get pregnant? Yes, it's possible depending on the size and location. Then also, you should also be aware that there could be increased complications such as increased risk of miscarriage, increased risk of preterm delivery, and even having severe pain, especially in the second trimester, when the fibroids start undergoing what we call regeneration. But it's possible, but you should have this at the back of your mind. Or if the fibroids are located directly inside the womb or in an area where they are blocking the fallopian tubes, you might not be able to get pregnant while they are still there. Thank you. So I will be stepping out again to attend to a patient. I will join shortly. if they're at the end, if I still have any question.
Any question? Okay. I think that's all the question we have. Any other question?
You're welcome. Miss
Chidimma.
Anyozie Chidimma.
Oh, thank you very much, Johnson.
Thank you.
Okay. The absence of any other question?
But since there's no question, and there's any question maybe for yourself, your relative, or anybody that you know, can come to the pharmacist, come and make your complaints. Then we can address the issue. I will give you a follow-up feedback, even online as well. Thank you.
The medication for the nipple discharge. That's what we said. Bromocriptine helps with that, but it's under prescription. It has to be prescribed. Bromocriptine and carbagolene. It's on the screen. This Senago is carbagolene. There's also dustiness, right? Yes. Then bromocriptine. That's Aludel.
Okay, the next slide. That is the next slide.
So those ones are prescription only medications, and they're available. You're welcome. It's our pleasure. Okay. Any other question on the chat box? There is someone raising their hand. I think we should thank everyone. You can do that, right? Good.
Since there's no question, in absence of any for now, I would like to appreciate everybody for tapping the link and joining us in this very educative, very informative class, online class. See you next time. Thank you. Thank you very much for your questions and all your attendance.
Yes. And if you have further concerns, feel free to visit any Kenix pharmacy that is close to you, or reach us on our WhatsApp lines or social media handles, and we'll be able to respond to you. We also have ability to, of course, connect you to consultants depending on the specific need you have. So thank you very much for joining Kenix Care Conversations today, courtesy of Kenix Pharmacy. You have a wonderful day.
And weekend.
And the weekend. You're welcome.
Thank you for having me back.
Thank you very much, Dr. Uche. Thank you. Okay, you joined back. Okay. Thank you. Bye, everyone. Yeah. I'll have to share it.
Bye.
Bye.
Thank you.
You're welcome.
You're welcome.
Okay.